Republicans, of course, shining a light on the positives of the CBO report, but will businesses and Americans, that's a bigger question, will they see it as a big improvement over Obamacare? Bringing in right now, joining us, RealClearPolitics co-founder Tom Bevan, along with Fox Business Network's MacDonald. Tom, let me start with you. The Republicans are pushing back on the CBO score even before it was released, understanding that this is that they have a faulty track record, but also knowing that they would find some losses. To what degree, we weren't sure. So how do you sell it to the American public and to the American businesses out there?
Well, that's a great question. I mean, in many ways, this is now a public relations battle as Democrats are out there, as you heard Nancy Pelosi ran that clip of her earlier saying that, millions of people are going to get thrown off insurance. Republicans have to emphasize that the aspects of this law that are favorable to them. In many ways, the CBO report was better than they expected in terms of deficit reduction and the like. And so they've got to emphasize, I think the key distinction for them to get over is that the coverage, the loss of coverage that will ensue, the CBO projected, a majority of that is because they're going to repeal this mandate, and folks who were forced into insurance, forced to pay for insurance, may opt out or may decide not to get any coverage at all. And so if Republicans can articulate that, I think they'll be in better shape. Otherwise, it's going to be a tough sell for them, I think.
Yeah, Emac, I think if they go down that path, it could be a little bit dangerous saying that people don't want health insurance coverage. Certainly everybody wants it for themselves and their kids. But wouldn't it be smart, too, to say this President Obama made people pay for insurance they couldn't afford? Let's get the private sector in there and get some cheap plans out there.
Well, the joke about socialism is, what is a sardine? It's a whale after 10 years of socialism. I mean, that's also could be said about your wallet after Obamacare, because that's been the complaint, that the insurance deductibles are so high, the premium costs started to skyrocket. And Gerri makes a great analysis here about how CBO has been totally wrong. And we understand that. And by the way, Keith Hall, who runs the CBO, is a Republican. I think he's under the gun right now. But, Obamacare promises were 26 million people by this time would be enrolled in the exchanges. Turns out now the CBO was wrong about that. Now the CBO is saying 24 million people will be without insurance. I think that we need to step back and remember what Obamacare did. Not just insurance premiums going up and deductibles. I think the Republicans need to point out how bad the part-time job increase in the number of those jobs has gone up.
Right.
You talk about Staples, you talk about hundreds of companies, including colleges, including local governments, putting workers on part-time status. I think that's sort of lost in this context right now of the GOP trying to sell their replacement plan. The Democrats are better at political theater than the Republicans, so I see that that context AWOL right now.
Well, then that's not necessarily good news, Gerri, because this is officially transferring from the Democrats' problem to the GOP's problem, and and I think Emac brings up a great point with respect to the redefining what full-time work was, the crushing impact that it had on poor people and small businesses. So what do you see between now and the ultimate product? How to sort of get around some of these issues that are challenges for them?
Well, it's going to be very, very tough because, look, as Liz said, the Democrats much better at putting together a narrative that's appealing, talking to the American people on this. Republicans, though, they have a plan. They've been unable to articulate it in ways that are attractive to the American public. Look, the reality is that ultimately Obamacare was falling apart. Something had to happen, and the people who are getting hurt, let's just be very clear here, they would be the people watching your show right now. They're people who have their own business, trying to get ahead on their own, paying their own way on insurance, right? And their costs went through the roof in the independent market. Why? Because they were required to have a soup-to-nuts policy that required everything from maternity to drug coverage. Maybe they didn't need that. So there was absolutely no flexibility in this plan. And I got to tell you, the Republicans would be good to point that out right now and to talk about how the other parts of their plan, they have a 1, 2, 3-step plan. How are those second and third tranches of change? How are they going to impact this overall effort to fix health care, which is so complicated?
The only problem with that 1, 2, 3 plan is that even members of their own party aren't necessarily buying the 2 and 3 part of it. So that can be an even tougher sell. Tom, getting back to the idea now that health care insurance should be something that the federal government is in control of. Is it too late to roll that back? Is it too late to say this is actually something that probably would work better if the federal government wasn't involved at all?
Yeah, no, that's a great point. And this is what Republicans are trying to do is, in fact, very difficult. I mean, they're trying to roll back a new entitlement program. And I think, you know, looking at this, they would have been better off had they beaten Obama in 2012, because what's happened over the past 4 years is that this has now become sort of ingratiated in the public, accepted by the public that the government is involved in health care. And so for Republicans to say that they're going to roll back some of this coverage and that people will either have more choice, Democrats are able to say, look, they're losing coverage. That is a very tough sell.
Yep.
And so it's going to be tough sledding for them. I think they have to emphasize, though, I think their strongest point is that, look, the status quo was unacceptable. People know
right.
in their own lives across this country that the status quo, that Obamacare had some big failures as a part of it. And if they can continue to emphasize that, they might be able to get people to sign on to making changes. But
right.
otherwise, it's going to be really
highlighting that even more, Emac, is the fact that people who have used Obamacare hate it the most.
Yeah, that's right.
Go ahead.
You know, Tom makes an important point. I think that basically Obamacare's main effects were to put more people on government welfare via Medicaid. That's going to be really hard to dial that back. I don't think they will. And it basically had that effect, and its other main effect was it basically caused people to not afford insurance, to be able to buy insurance on their own.
Yeah, of course. And people have plans, guys, that they had a plan on paper, but they couldn't use in reality.
Yeah. Well, that's just the point. We have to talk about the quality of care.
Right.
Are you actually getting the care that you thought you bought? That's right.
If you can't afford the deductible, then you know, you don't even go to the doctor. You're walking around with that ailment that you would have walked around with anyway. Guys, let's leave it there. We almost solved it. We almost got there, but maybe next time. Thank you very much.